Colombia. Whoop, let me get the right glasses on so I can actually see you. Hola, Jerry Samson here in the United States. Juan Roberto Lopez and I have a very interesting course planned for Friday, July 17th, 2015 in Medellin. The topic is bent and totally wired, arch wire hands-on fabrication. The course is strictly limited to only 40 people. We will be doing things like differential arch wire selection, hands-on arch wire bending and control in 3 planes of space, first, second, and third order arch wire bending, arch wire space closure, crown root angulation, torque, what to do when straight wire isn't working. Imagine that you look in the patient's mouth, you can see what needs to be done, but the straight wire appliance isn't doing it for you. The arch wire must be bent. We're only accepting 40 people because of the unique nature of the course, and from the United States, I am bringing teaching assistants with me. All of the supplies that you need will be included in the tuition. You will need to bring your own orthodontic pliers, and registrants will be sent a pliers list. Again, this is Friday, July 17th, Medellin. Register with Juan Roberto Lopez, but let's take a look at what we have in mind for you.
Welcome to OrthoGnathos 2015. We have a spectacular course planned for you July 17th, 2015 in Medellin. Dr. Juan Roberto Lopez and I will present a very unique hands-on wire bending course. This course is called Totally Wired and will specifically concentrate on you bending wires with direct supervision. This is a very limited attendance course. This is how you get in touch with Juan Roberto. Notice his email and notice what he looks like. Juan Roberto. Contact information, once again. This will be a very limited attendance course because of the nature of the course. That is the hands-on wire bending. You will be bending wires for in and out, up and down bends. Those are called first order bends. You will be bending wires both round and rectangular for crown root angulation or crown root tipping bends called second order bends, and of course third order bends referred to as torque. These are some of the exercises you will be doing. Take a look at the first order bend. You'll be using something called a step plier, also called an offset or hammerhead plier, and we will have you do a step-up bend of the upper right central. What is quite unique about what we are going to teach is that these adjustments are done intraorally, inside of the mouth. The wires are not removed from the mouth for both step up and step down. Also, you will be doing step out and step in bends. We will be discussing should you use round, square, or rectangular wires. And you will be bending these wires as you see on the diagram. First order bends, second order bends, third order bends, and also a detailed discussion about when to bend the arch wire versus rebracketing. Just imagine that you look inside of a patient's mouth. You have rebracketed the tooth or teeth, but you are still not achieving the treatment response you are after. You can see what needs to be done, but the appliance itself is not doing it. We will also be doing omega loops, V-stop loops, and discussing in detail what the indications are for each of those bends. Quite challenging for some people are the crown root angulation or second order bends. These are for marginal ridges. We'll be using arch forms for this. These are also called root tip back bends. You'll be doing this on various teeth. root tip forward bends. And again, the trick is to do the bends intraorally, and then the wire is removed to exaggerate the bend with a specific plier. Typically, you do very little arch wire marking. What you actually do is make the bends inside of the mouth and then exaggerate them, as we will show you together with a team of instructors. The assignments that you will be doing will include this type of thing, a crown root angulation or a second order bend. The initial bends are made inside the mouth and then exaggerated outside of the mouth. For example, you'll use arch blanks, in this case a 16 round stainless steel wire. This is an example of a root tip back, crown tip forward of an upper right cuspid. And if you look at the bottom of the drawing, a root angulation bend for the lower right second bicuspid. When to do this versus when to rebracket. Certainly you've had the experience of rebracketing teeth, and then you are still not getting the response you are after. Arch wire bending. Those skills are essential if you are going to achieve ideal end results. Let's take a look at this example. The root of the upper right lateral is too upright. A second order bend is placed, and then the root crown relationship is very, very easily affected without affecting the adjacent teeth. Without the affecting the adjacent teeth. This is what we will be teaching you to do hands-on with a team of instructors, so that the student-instructor ratio is excellent. I'll be bringing very skilled people with me from the United States. That is why we'll have the course very limited attendance. Oi, Colombia! Yes, Colombia! One of the more difficult things, yes, when we have trouble with torque and we are looking for answers for trouble with torque. For example, let's look at this particular case. This is a troubleshooting problem that was sent to me. Pre-treatment, this is what the patient looks like. What would you do in this particular example? Take a look at the lower arch in your lower right hand corner. How would you align those lower incisors, and do you see any potential trouble coming? What would be your treatment mechanics? What we need to do is simply align the teeth, have some vertical forces to seat the occlusion. Do you see anything that comes up that might be a problem? Look at the lower anterior teeth. What has happened there? Well, this orthodontist sent me these cases to find out why this occurred and then what to do about it. He ordered a cone beam. Look at the results that we're seeing at the lower anterior teeth in your bottom right hand picture. The roots of the lower centrals have come right through the cortical plate, and the roots of the laterals are nearly through the cortical plate. Why did this occur? Further, the cone beam analysis shows a severe amount of lingual root torque through the lingual cortical plate. Perhaps this has happened to you. Perhaps this has happened on one tooth or more than one tooth. A major question is, why does this happen? We will have a detailed discussion which has to do, if you look in your lower left-hand corner, you'll see the green dots. That has to do with the center line of resistance and what can happen during rotations that can cause lingual force, and therefore in some patients, not all patients, the roots of the teeth come through the cortical plate. There are situations where a compromise is the only option. We will be discussing those in detail. This is one of my patients. How would you align these teeth? Well, once I align the teeth, do you see the problem? Again, this is my patient. Do you see the problem? It is right there. The lower third of the central incisor is bulging through the lingual cortical plate. That is the tooth we are looking at, and obviously there was some sort of lingual force transmitted into the root, causing a rather unpleasant treatment response. Here's the same patient corrected. How did I correct the problem quickly with a third order torque wire bend, and what type of wire was I using? A stainless steel wire will not be effective in this situation. We will be talking about which wires are indicated, and you will actually do the hands-on wire bending yourself under supervision so that you are not confused when performing these techniques clinically. Let's take a look at another difficult situation. Perhaps this has happened to you. The challenge is that an upper lateral incisor needs facial root torque. In this case, it's the upper left lateral. Take a look at that from a frontal view. This is not a step-in problem of the upper left lateral. In fact, the upper left lateral is in contact with the lower left lateral and cuspid. What needs to be done is to bring the root forward. Looking at the incisal edge, we can see obviously that this is more of a torque problem than a first order step in, step out situation. Let's see how that was resolved. Here's a close-up view, and here is the patient in 10 weeks. That was one adjustment and then waiting 10 weeks. You can see that the lateral incisor is now correctly torqued with very, very minimal effort. It's knowing the technique of wire bending. It's knowing which wire should be used for these torque or twisting problems. Here is a problem. If you look at the upper right second molar, and then in one visit, this torque problem is corrected very, very easily. How was that done? Which wire was used? This is one adjustment, one visit, but of course it's critical to know which wire to use and how to bend the wire. Therefore, we will be talking about solutions with torque problems. Here is a patient with modest overbite and overjet issues. Take a careful look at the overbite and the excess overjet. You can see the excess overjet from a lateral view. Also, the upper incisors appear to be possibly over-torqued. We see an asymmetry. One side looks good, and the left side, there is a torque problem. This is one visit, and the problem is corrected. Notice the dates, April 12th to May 9th. One visit, and the problem is corrected. How was that done? Which arch wires were used? And how are these simplified mechanics instituted with minimal effort? This is an 18-month treatment time. This is the patient finished. Notice the nice aesthetic torque angulation when she smiles in profile. Just a look at her panoramic view at the finish, and here's the same patient 18 months after treatment. Very acceptable facial balance from a profile and profile smiling view. The incisors are not too upright and not too proclined. I consider that to be very, very important in detailing and finishing. We will be talking about how to do this in detail with simplified mechanics. Mechanical principles can be very complicated, but they can be easily understood when explained clearly. These are the concepts of additive and subtractive forces. We will be talking about the difference between additive and subtractive forces in torque and in rotations. We will be talking about differences in force-distance ratios, making this very easy to understand and very applicable clinically. Basic principles of why with a couple the center of resistance and center of rotation are the same. When we are dealing with anterior torque problems, this is a very important concept. Also, the use of class 2 elastics under torquing problems. So this will be wire bending with class 2 elastics. Let's take a look at this simplified approach. You'll notice at time 1 on November 13th, 2013, there was an end-on towards class 2 discrepancy, and with very simple wire bending and class 2 elastics, you'll notice that at time 2 to 3 months later, the problem is corrected before the rest of the brackets are placed. On the right side, you'll notice that the canine is now a very, very substantial class 1. This is all before the rest of the brackets are placed, and in fact, this patient was treated upper arch only. What type of wire is in the lower arch? How will I avoid the lower molars from moving into an unacceptable position? We will talk about that in detail. Next will be the closing loop arch wire. So there are distinct advantages. Here you can see intrusion and detorquing being done at the exact same time using what is called a tension helical closing loop. You'll be bending these wires. These are 1622 stainless steel wires, and we will talk about details of using class 2 elastics along with these wires. I do not use headgears in these situations. Headgears only work when the patient wears them, but the closing loops are working full time. A key question that I will address is when do you use closing loops versus chain elastics in what are called directional force controls. You'll notice here I'm moving back to a round wire, pegged laterals. What will be the end result and where should the teeth be placed with these rather obviously pegged laterals? You can see on your top left screen that I needed more overbite and more overjet at the upper left lateral. That happened in one visit by using a specific wire, and you'll notice in the back of the mouth, if you look very carefully at the upper left first molar, you will notice an omega loop is bent into the wire. What's the purpose of the omega loop? Why is it tied back? Why is the arch ligated the way it is? And where should the upper left lateral be placed for restorative purposes? These types of exercises make people doing orthodontics very happy because you learn how to bend the wire versus reposition the bracket. Be happy. Keep in mind the date, July 17th, 2015 in Medellin. This is an exclusive course with me, Jerry Samson, Dr. Juan Roberto Lopez, and assistants that I will be bringing with me from the United States. Totally wired, hands-on wire bending. Everything will be supplied to you as far as the wires. You will need to bring your own pliers. Each registrant will be sent a pliers list of what to bring. Questions should be referred to Juan Roberto Lopez. This is a very, very limited attendance course. I'm hoping to see you then in Medellin with Juan Roberto.